welcome to this lesson on ventilators, aka vents as we commonly refer to them. Uh, the purpose of this lesson is to really talk about the basics of the ventilator, the different modes that we commonly will see, as well as to talk about some of the different settings that you'll find within each of these modes, and to really hit on the basics of what these settings do in terms of the ventilator support that we provide. The purpose of this lesson isn't to go in too much detail about how to make changes to those settings, the impact of making those changes, and what things to look for and what you would expect to see with doing so. Like I said, it's really just to cover the basics to give you a good idea of what is going on with each of these modes and the settings associated with them. This is typically a talk that I would do with a lot of the newer nurses onto the unit, so specifically the new grads coming into the ICU as well as the new to ICU nurses. But I also think that there can be some value in nurses that aren't necessarily new and just really want to have a good understanding of the ventilator, what it's doing, and the different common modes that we often will see with it. In my opinion, and probably the opinion of others, the vent is the most important life-saving intervention that we can provide in the ICU. It's certainly one of the most common ones, if not the most common one that we will use. But in terms of the value to our patients that the ventilator can provide, it is unmatched with anything else that we do. There's something that we will see constantly in the ICU. Many patients will need some sort of mechanical ventilation support, and it's really important that you, as a bedside nurse, have a good understanding of what is going on with the ventilator and how it's providing support for your patient. Far too often I have seen nurses who are merely going through the motions when taking care of their patients who are on a ventilator, and I think it's really important that you have an understanding of what is actually going on in order to provide the best care that you can for your patients. So before moving on and talking about the different modes that you often will see, there is one key point that I want to stress with the ventilator support, and that is a ventilator is doing absolutely nothing to fix your patient. So let me say that again. A ventilator is doing absolutely nothing to fix your patient. And what I mean by that is the cause of the respiratory failure that led to us having to provide the mechanical ventilation support. Let's say it's trauma, it's neurologic, sepsis, whatever the cause of that respiratory failure is, the vent is doing absolutely nothing to fix that problem. It's merely a support device, providing the respiratory support that your patient needs when they're unable to provide for it for themselves. So again, the vent's doing nothing to fix that underlying problem, and in order to ultimately get them off of the ventilator, we need to correct that problem first before we can even look at taking away that ventilator support. Alright, so now that I've gotten that out of the way, let's move on and begin to talk about some of the common modes that you will often see with the ventilator. And in talking about these modes, this day and age with modern ventilators, there are many different types of modes, and depending which brand of ventilator you're using, you may see some of these modes referred to in different terms. And as we go through and talk about them, if there's a common alternate term from what we usually refer to it here, I'll mention that way. If you're out doing some of your own research and you come across a different term, it'll make sense that it's something that you already know. But like I said, there's many different types of modes of ventilation, and I'm going to cover the main primary ones that most people in most institutions and facilities will often use, as well as they are the common ones that you will see here. In understanding these different modes, it really sometimes helps to take a step back and really think about at a simple level what is going on with the ventilator. And this may sound overly simplistic, but all a ventilator is doing is moving air into your patient and removing air out of your patient. That's all it's doing. And if you look at some of these different modes that we talk about and you take a moment to just stop and kind of think about how is that air moving in and how is that air moving out, it might help to make sense of these different modes and what's happening. This is also important to where if you come across one of these other less common modes of ventilation that you may not immediately recognize what it is and exactly how it works, but if you take a moment and talk to your respiratory therapist, who, by the way, are fantastic resources in understanding what's going on with the ventilator, but talk to the respiratory therapist, talk to the physician that is ordering the mode, talk to some of the other more experienced nurses that are around you, and like I said, if you figure out what those settings are for that particular mode of ventilation, and then you stop and just take a minute and again think back to that very simple air moving in, air moving out, and think through that process of, in this particular mode, how is that air moving in and moving out, and what is it doing for my patient? It can really help you to understand other modes of ventilation that you may come across that you just aren't familiar with. And so, with that said, when we start to talk about the common modes that you will see here, it really helps if we take things and divide it up into two main categories. So when we divide these modes up into these two main categories, the first of these categories is what we call volume control. And the second category is what we call pressure control. And with these two categories, it really lumps together common modes in terms of the thing that the ventilator is focusing on when it comes to delivering breaths to your patient. So in our first category, volume control, pretty obvious the thing that we're going to be controlling with this is volume. So if you think about, you have your patient here, and the ventilator, we're giving them the breath through here. The thing the ventilator is going to be focusing on, like I said, is how much volume is going to be going into the patient. And we'll get in and talk about, some of the specific modes that we'll see within volume control in a minute here. But like I said, the important thing is to focus on the vent is going to deliver a certain amount of volume with each breath to your patient. Now, our other category that we have here, pressure control, again, pretty obvious. The thing that we're controlling here is our pressure. Take a minute and look back at our volume control. The way that the vent delivers the volume is by pushing with a certain amount of pressure. That pressure may vary or change in order to ensure that the patient receives that same volume of air. Well, the opposite is true in pressure control. So now, again, let's say we have our patient over here, and our ET tube coming out. The thing the vent is going to focus on is the amount of pressure that's going in. So the analogy I like to use is it's like filling up a bike tire or a car tire. We don't fill those up with a certain volume of air to go in there. Instead, we fill them up to a certain amount of pressure, and this then in turn will cause a volume of air to go in and inflate the tire. Very similar thing that's going on with pressure control. So instead of focusing on how much volume the patient is going to get with each breath, now we're going to focus on how much pressure we're going to use to deliver each breath. So that pressure is going to stay constant. What's going to change now is how much volume is going into the patient. And again, we'll get into talking about, all these different various modes, and I'll hit on, some of the differences in the variation that you'll see with your pressures in volume control, as well as the variation in volumes in pressure control when we get to talking about those modes. But for now, I just wanted to outline the two main categories that these modes will fall into and kind of explain the difference between those two categories. And it will make more sense when we get to talk about the different modes within each of those categories. So I'm going to end the lesson here, and when we pick back up, we'll talk about some of the different modes and settings that you see within volume control.